All right, so we're talking about healthcare everywhere, as Dilip said, we'll start off with Jeet on the right hand side here, on my right. Jeet, tell us a little bit about yourself and why are you here?
Okay. Good morning, everyone. Perhaps good afternoon, almost. Yeah, 7 minutes. My name is Jit Barmecha, and so good to see most of you. And Happy New Year to you and your loved ones. I'm a practicing hospitalist part-time, and my full-time role is Senior VP and Chief Information and Digital Strategy Officer at St. Barnabas Health System in the Bronx. And thank you, Megan and Shahid, for having me here. And obviously, I'm here to learn from everyone and looking forward.
Great. Cletus?
Cletus Earl, many hats. I don't know if it's working very well. Many hats, but right now I am the field healthcare CTO for Citrix. Prior to this, I've been here before representing as a CIO on that side of the stage at Penn State and a few other organizations, to just name a few. Happy to be here. Thanks for being.
Awesome. Dilip?
All right, good afternoon, everyone. So you must love New York, right? You know, or you like love Megan, one or the other. Maybe Shah, right? But good seeing you. Many familiar faces. It's always great to be in the Health Impact Forum. Megan always bring a talented individual here in a room, and we share a lot of ideas. And when you go home, we actually re-energize ourselves because what resource she bring it in this conference. So truly, thank you for what you do, Megan, for the leaders in our industry. So by way of introduction, my name is Dilip Nath. I'm just a regular tech, uh, but officially I'm a CIO at SUNY Downstate Health Science University. You know, that's what 80%, believe it or not, but 80% of the providers that practice in New York, they come through our university one way or the other as a student, faculty, resident, you name it. So we are so proud of what we do. So looking forward to being a great conversation.
All right. Awesome. So, Jeet, let's start with.
Shahid, before you go to our question, can I give you the real answer why I'm here? Because you asked me
Absolutely,
this
go for it.
question. The first question was introduce yourself, and then second was why are you here? I'm only here for Megan.
That's a great reason.
Yeah, I cannot say no to her. So
Nobody
Thank you.
can.
Okay, get on with the show.
All right. So, Jeet, when you think of healthcare everywhere, what does that mean to you in February 2026 with everything that's going on? You guys, you see it at your hospitals, you see it in your daily work. Things are changing very rapidly in some places, but they're not changing at all in other places. So talk about that a little bit. Is what are we getting wrong in terms of where things really are changing on the ground? And then I'm going to ask Dilip and Cletus the same question from their perspectives.
So let me give you two perspectives. First perspective as a provider, and the second perspective as a patient or caregiver or consumer. When I started my residency, we were on paper. The only thing electronic was the lab system or revenue cycle. Now I see, I mean, I just finished my rounds early this morning. It is everywhere. It's like digital twin. I mean, there are different definitions of digital twin. One is what you have in front of you, whether it is a desktop or mobile devices. And things are getting better. I would say we are in the acceleration phase, not transformation phase. Two things. One is your identity. How does the network know who you are in terms of accessing apps? Now I'm talking about on-prem, not outside the network or outside the hospital, actually. We do have very good tools, and we are still looking forward for better tools in future, so that not only the network understands who am I in terms of identity. I don't want to name any vendors, but again, over the years, they have gotten better. The app or the network understands who am I and how do I access. So that is number one. That is getting to the network. And then second is the infrastructure of the network, authenticating who you are and what are you accessing, whether you are accessing any apps or you are accessing any applications, or within the context, what are you accessing? Um, Yes, there are times which can be very challenging in terms of accessing the cloud-based apps because they have their own authentication process. So we are not there yet to have a whole umbrella over different apps and how do we access. But in terms of mobility, I mean, we can go from room to room. If you're a hospitalist, you can just have to tap and go, and at least the network knows who you are. The desktops, they know who you are. And in terms of EHR or any other application, it has become very easy actually, both on the mobile devices and as well as on the virtual desktops. Uh, Not so very good when you are outside of the hospital, when you are getting into the hospital network. We are still using several authentication factors or several ways of getting into the network. That has been some challenging, especially for the legacy system where you have to get through the VPNs, not through the modern way of accessing. So yeah, those are work in progress. As I said, these are acceleration. And in terms of consumer side, even for them, health is everywhere. I mean, they can click on through their portal and get access to the virtual environment. But again, there's a lot of work that needs to be done, not only from the clinical perspective, but also from the other uh, areas which is surrounds your clinical, whether it is access or revenue cycle and all. So I think things have gotten much better. And I'm sure I'm looking forward for Citrix or other vendors, what they are doing in the space, especially when we'll be talking through the agentic AIs or the bots or non-human interactions.
So can you add on a little bit more? Is that where you do see the lacking of either capabilities, et cetera, do you feel that that is now more of tech is available and you guys at your institution are getting around to implementing it? Or is there fundamental lack of technology that you, even if you wanted to do it the way you wanted to do it, you couldn't because the technology is not there? Which do you feel?
I think to some extent technology is there, is the cost, at least for us. And number two is maintenance of those tools and applications.
Okay.
But again, it needs to be very, very seamless. So.
Nice. And so Cletus, bringing you in here, Citrix almost invented this idea of remote computing, right? So it's a good place for you to be there. But based on your past experience, especially at the senior leadership areas, follow that question up is where is it? This tech has been available for a while. What is causing these gaps where they do exist today from your perspective?
I don't know if this is working very well. You guys can hear me?
You want to use this? You can have both.
Oh, all right. Whatever.
It's like
I'm good.
It's like a
Yeah.
press.
Yeah. So first of all, as I said, I wear many hats, and one of the hats that I wear as a board member for a local health system out here. Shout out to Ron Goldman, the CIO for One Brooklyn Health, as I'm on the board there. So I do understand intimately the journey of healthcare anywhere, because in today's world, particularly with the administration's effort to reduce some elements associated in Medicaid, Medicare, and making sure that the health element is outside of the four walls of the institution. We've seen this journey for a few years, but now it's accelerated. It amplifies the ability for us to facilitate that from a technical perspective and matching up with the clinical side. So I am actually very, very proud, or I should say, lucky from my career path to be aligned to Citrix in this organization. And we're not name dropping, but you can learn more about the technology out there. But
And you should.
Yeah, from the stage perspective, it's exactly doing what you said. I do believe the technology has always been there. It needed to evolve a little bit, and it is evolving around identity management, the stool, right, the three-legged stool, to be able to connect all of the dots from a infrastructure side. I do think over the last 10 years, we've had so many different things, whether it's the mergers and acquisitions, whether it's the implementation of EMR. For those long-tenured IT professionals in the room, you remember 20 years ago, I'm looking at Shafiq, when we were in the audience of, the chimes of the world, when Meaningful Use came out, there were people who were saying over my dead body, doctors, that we're going to go down that road. Look, 20 years later, we're having such a different conversation. So the technology is there, right? But we have not been able to focus on the things to configure and adapt and utilize, because we're always in the healthcare sector chasing the next shiny object.
Yeah.
Right. And the drives of the institution and the boards and others tells us to go here or go there, or regulatory elements. So I do believe, like in my role, my goal is to help institutions, right, with their current investments, being able to say, okay, you have the tech stack. Let's utilize it effectively. Let's make sure you turn on this stuff. Many times as a CIO, I would invest in something, or an organization would invest in something. And because you have so many things happening, you realize that, 6 months, a year later, you said, hey, how did that, what happened to that thing over there, right? And they said, well, we only implemented 20 to 40% of the functionality. And therefore, the thing that you did a ROI on, that button wasn't turned on. And you're like, and I've heard this time and time again from organizations. So it is the time for us to really say, okay, let's not pause, because you can't pause. It's not realistic.
Right.
But let's look at the things that we have within our ecosystem, and let's try to figure out how we can work with our partners to be able to maximize the cost. And that includes the EMRs and all the other type of vendors that you have within your confines of your system.
Now, for those of you listening here, that is such great advice, especially the innovators. Think about it. We created a company in the previous nursing panel. Here's two more companies, Diffusion Tech and Implementation Tech. Diffusion means implementation has occurred, but it's not, let's just say, not exactly the same in the entire organization. So diffusing the tech that's already there, super, super critical. And if you've got services, technology, capabilities, bring it to attention. And then there's the implementation technology. And this is where, and I'm going to open it up for questions here in a minute. I'm going to ask Dilip a completely different set of questions. But think about the AI utilization, where you say, well, we're using it in administrative AI, like Automation Anywhere does a good job classifying these into clinical AI and administrative AI, et cetera. But there is also this special implementation AI that we could use now. So if you're having identity resolution, identity management, et cetera issues, you could use AI to help you do your planning for identity resolution, identity management, et cetera. So if you take any problem with infrastructure and you are not using AI to apply it to your implementation of that infrastructure, well, then shame on us from a technology perspective. So that's a great advice, and hopefully everybody's going to listen to that. So before I open it up for questions, Dilip, I'm going to give you probably the hardest question here, which is...
I don't know what is on the menu yet. Lunch is not out yet.
That's right. Not the different hard question.
Okay.
The harder question is, and especially because you mentioned so many students come out of SUNY into the workforce, what is it that we can do to get the humans prepared for this new world order? So assuming that we get all of this infrastructure right, which of course you're helping your own institution with, even if all the infrastructure is there and we've got care everywhere from a access app, et cetera, the humans aren't ready. So where are they unready, and what can we do in the SUNYs of the world to get them prepared in a... I'm not saying somehow they're incapable. It's just that we don't teach them those areas that they probably need in order to best utilize these now diffused or potentially implementation ready.
So how do we make the technology really humanized, right? That's what you're getting to. Look, in 2026, clinical mobility is not an option. I mean, no organization should talk about we should have a mobility. It needs to be there. It is the fundamental of providing a care today. And that is exactly why here in New York, our governor actually took initiative to invest millions of dollars in digital transformation. And she took that as the core because she realized that to move the healthcare forward. And also healthcare equity. For generation, we talk about the healthcare equity here in this country, but we have not done enough to close that gap because nobody had talked about the technology justice. And that's exactly what we are doing from ground up, meaning not only building the infrastructure and shiny object, all of these different tools, but get ready, prepare our next generation of providers while they're in medical school, right? Build something with them, have them fill the EMR so that on third year medical school, fourth year medical, they're fully ready in the workforce. And also the tools and technology that we are building today, we want to make sure they have a say in it. It's not the government that we used to have only CIO, CMIO, but we also need to include the medical in our residents so that mindset we need to create. And that's exactly what we are doing as we are, rolling out the next level of digital transformation that our legislator actually mandate us to do now. Because I think far too long, what we also see in the whole tech world, particularly in the healthcare side, there was a mindset if you have a system that's been working for the last 30 years, and believe it or not, we have a revenue cycle system, and there are several clients in New York been using for the last 40 years because it's been working so great. But we have not realized the amount of technical debt it has accumulated over the years. And that's really put many organizations behind in bringing the digital transformation and mobility and everything else that we are discussing today. So finally, government realized, if in the private industry they're different, so you know what, we got to do something about it. If you wanted to close the healthcare equity, we need to invest in technology, infrastructure, and all of these different layers that we're discussing today. And that's exactly what is about to happen. It's already happening. And as you heard from the news, there's a millions of dollar investment. I'm part of the student. We are 88,000 employees strong, 1.4 million students, and 3 medical center. And she has invested hundreds of $millions because what we see in New York or our healthcare, not today, but years from now.
Yeah. So one thing that especially students and those coming in that want to do something, what we now have today that we did not have even 4 short years ago is the ability for anyone with an idea who has no software engineering skills, no computer development skills, nothing, could actually build your own software to meet or exceed your own goals that you're setting for yourself. This is the height of what we call individual contributors. So as a software engineer, I didn't believe that in my lifetime, somebody would able to be doing software engineering without me. But not only is it in my lifetime, but I'm doing it myself. I have now coded more in the last 18 months than I have in the last 10 years and produced more code that went to production more rapidly. And then I'm able to show that now too. And it's so amazing and really, really nice to see a doctor who has an idea actually goes in and uses the AI to code the thing that when I say code, I don't mean like CPT code. I'm talking about like Pascal code, Java code. Like Pascal was kind of invented at SUNY, but so you have Pascal, Java, these kind of languages that we all Python that we're using. Every one of you now do not need to have any of those skills, but you can create software faster and better than I could because you actually have real use cases. I have pretend use cases. I have to actually go interview Jeet to figure out what do you need. Well, you guys know what you need. So I would take this advice to heart, which is not only do you have to be involved, like that's the old way of thinking about it. You're the lead now. You can create the software and then hand it over to infrastructure and say, okay, go figure out how to implement, secure it, go figure out how to do, accessibility, go figure out how to do X, Y, Z. And if you start from there, the world gets better, both with equity, access, and all the stuff that we wanted to do because it's not coming from the top down now. You guys are picking it up from the bottom up.
Yeah, can I jump on that question that you had? And again, when I was at Kaleida, Great Lakes in the Buffalo area, I did the same thing at Penn State. We wanted to make sure we introduce the technology element early, particularly with the medical schools, whether it was University of Buffalo Medical School or Penn State College of Medicine. We wanted to inject the methodology of the EMR, the functionality, the tech stack early because unfortunately the clinical model of education does not have anything to do with technology.
Yeah.
So we worked as senior leaders, right? Worked with, the curriculum to start to introduce these solutions sooner than later. And it's not just for the doctors, but also in the nursing schools, right? Making sure that the medical record that they're using is part of our ecosystem.
Yeah.
And when you start doing those things, introducing early and not waiting for, the person to go out and then get paired and matched and whatever, then you start to see there's some level of engagement, earlier engagement and adoption. And
Because they
then
own it.
now they own
Yeah,
it,
yeah.
right? So I challenge all of you leaders out here to start to think things through that way and start to introduce things earlier so that there's better adoption and therefore you're not necessarily trying to recreate the wheel. Because a lot of these young folks, right, they understand the new technologies like no one else. They're able to contribute in ways that we couldn't even think about 20 years ago.
Oh, absolutely. Yeah. So questions in the audience, please.
Can I add
yeah,
one more
please.
thing? I apologize. We will have a lot of questions to answer. For me, the most important thing is it starts from myself and my colleagues and the analyst team. I mean, last 3-4 years,
The analyst team are the data analysts?
no, the analyst or application analyst or
okay.
business analyst or the data analyst, we all have to learn because in last 3-4 years, not to disclose too much about my professional secrecy, I thought I thought when I did some courses on the language models that I was a little bit proficient on large language or small or medium. I just found out last week that how much I do not know. I was in LA and there was a executive AI session and we had Professor Yuan from NYU talking about LMs are old because these are not very, very multimodal. They do not do reasoning very well. And the architecture which he described, first of all, I did not understand anything what he was saying, but it made a lot of sense. It made so much sense because up until LLMs, I mean, you put in the text, you get some, it's like a search engine on steroids or something based on the language models of the data sets. But the research, what he showed, what he did at Meta and the Army labs, it just blew my mind. And I was texting my wife. I said, you know what? I have to go to some school again. So coming back to education and training, and it is coming so fast, like every month or every week, we learn something new. And as a health system provider, we only use technology because we don't manufacture technology. Or there are some health systems who do co-development, but we are not in that position. So since we are using those technologies, we need to understand how it has been built, what were the workflows which were embedded, whether it is clinical, operational, or financial. And this is very important. When I came back on Sunday, told all my staff that go to Coursera or whatever, you need to go beyond LLMs, what is happening. So again, training your own staff, myself and my colleagues who are in the C-suite making those decisions, it is very, very important that we need to understand. Otherwise, we'll be lost.
No, I totally agree. So I thought I saw some hands. Did I miss? Okay, so let's pick up on that because what I do notice here is that, to be a little provocative, I think the sending people to go learn about things is probably the old way. You got to send them to go do something, right? Replace what they're doing today by the brainstorming sessions would be, what is it that you're working on today that we could build our own tools for? Right, very small, individualized tools for your department, for your staff, for your group. I think that's probably the only way that you're gonna, because what you learned on that last week is gonna be new 4 weeks from now, right? So we're still back in this situation. What I really am excited about is the idea that we are all just individual contributors. That's it. So when you go and build what you need, you are the builder and you are the user. That's the thing that we didn't have before, is that the builder was often different than the user. And that's why everything seemed clunky, Like a doc would look at the code that I wrote and say, why the hell did you do this? Because I say, well, I'm like an actor. All I can do is I can ask you what you do, and then I can pretend to be you. How about you just join me on my team and let's go true code development means there are 3 engineers and 9 docs on that team. Normally it's 30 engineers and 1 nurse, maybe a doc somewhere, right? That's a normal way that we develop. And it's not, I'm not blaming anybody. It's the business that we're in. And these are the kind of things that especially for the young folks and when I say young, meaning you're young in your career, like you're within your first 10 years of your career, that's pretty young in the healthcare industry. What are you guys doing to become that individual contributor for the tech that you need? I think is a very, very important question.
Yeah, I think it's extremely important because I wanted to talk about that point. There's a lot to be learned from other verticals, right? And, you know, the pod model, right? Anybody familiar with the pod, right? The pod methodology is doing exactly what you just said, bringing in collection of people from different areas to not only work together, but actually execute almost in the product-like model, right? Methodology or tiger teams, right? We've heard of these things. We need to collectively bring in finance, bring in, you know, clinical, bring in IT. We time and time again, we build things or we execute in these kind of silo models, and therefore when you do something, the end result is not what the customer, your clients and don't want. But if you create this multi-method model, right, of how you execute and deliver and offer services to your own clients, and that means other doctors, nurses, and others, then you're not necessarily missing the mark when you're trying to execute and get adoption, because you're getting different thought process, you're getting different reactions. So look at the pod methodology, look at tiger teams, have, you know, reliability, have consistency, continuity, and therefore you can actually now start to get more positive models or outcomes rather than actually build something, realize it's not working for the particular customer, then have to go and rework it.
Yeah, is that teachable, Dilip? This idea of the pods, et cetera?
So I'm kind of rethinking the way that we have been using technology and how we almost became a robot in many ways. And partly because we are almost like a vendor-driven society became, right? You know, Citrix designed with all due Citrix designed something, and, you know, Epic World designed something, and that's what we're going to practice. Jit, you know, as a physician, right? You know, what is your, you know, you don't have, you know, sort of your autonomy today to practice medicine the way you wanted to practice, right? You sort of using what Epic tell you to do, right? But that's not what we wanted to be. We wanted to have everyone freely think and come up with the creativity and care the patient that you think can do the best job for that patient. But unfortunately, we are in a surrounded by a tech vendor who dictate what is our future should be, and then compounded the problem with all the old laws and regulations that we have. And that needs to change, and that's about to be changed. Sadly, there we have a legislator in the state, federal government, those who doesn't understand technology very well. Now there are changes that are coming. Who understand, can embrace the technology. It's not a fear that it can change the mind shift of how we provide and how we, you know, deliver the care. We want a physician to act like they're physician. They're not a robot.
Interesting. So it's getting close to lunch, but I'm disappointed that none of you are asking questions. So there's one.
Haven't generated enough.
I've been trying to think about like the concept of everybody's an IC that you've been mentioning, and I'm struggling with it a little bit. And a couple of points that the panel brought up are actually reasons why I'm struggling with it. So first being, hey, we talk about this RCM company has been doing the same thing for 30 years. Now we have this tech debt. Well, imagine if every single person in your hospital is building a tool that helps themselves, the amount of tech debt that you'll accumulate over time.
But you already have that today. How many Microsoft Excel documents do you have in your environment?
Potentially, but now you have tech debt with physicians or whoever is creating technology and tools that also don't meet cyber standards and don't meet, like maybe they're not even solving the problem the way it should be solved. So you also have this agglomeration of tools that maybe shouldn't even exist within the organization. But I also believe that like everybody should be technical and you should build for yourself because it's extremely easy and that's not the difficult part.
Yeah.
So how do you balance that with the repercussions and the consequences of everybody building whatever they want?
One word, governance. Governance
Change
and change management, 3 words. So hopefully what I was sharing with you was not to have everybody go out there and do what they want to do. Not sustainable, not practical. We don't want it. You don't want shadow IT. So yes, there's change, there's governance, there's coordination in order to execute that. We want less systems, not more.
Yeah, and
But-
I, by the way, just one quick note, the reason I brought up the Microsoft Excel example is Microsoft Excel, unbeknownst to most of you, is a complete programming language, right? Internal to Microsoft Excel. And Excel is literally the most popular programming language. It's not JavaScript, even though it's on the TIOB index it says. So everyone who has ever used Microsoft Excel and pressed the equal button is a programmer. Period. Right? That means, and then if you connect two things, you do things in a equality, you drag and select and repeat numbers. This is all programming. Now, when you didn't know that it was programming, it didn't look like it. But now you're going to think about it and you say, "Oh my God, how did I become a programmer?" You just say an Excel user. That's what we have to say is now AI. That means beyond Excel now, you could be dragging, selecting, pressing the equal button, doing the formulas. Now, does anybody take a Microsoft Excel document and then, quote, put it into production? No, you just use it as a daily part of your work. And when you want to share it, you email it to somebody. Well, that all happens through natural education. We tell each other, it's almost a village teaching the villagers how you do this. And if we don't treat AI like that, it's going to accidentally become a bunch of shadow IT. But if we treat it like we do with Microsoft Excel, et cetera, and say, no, it's a controlled environment. We're going to put it in these areas. You begin the work, and then we'll bring in, quote, professionals or the ones who do this for full time to take it to the next step. That's a lot better, right? You begin the ideation, do your individual contribution, get it to a halfway point, a 3/4 way point, and then let it be finished up, aggregated, data comes in, security gets done, et cetera. But right now we're missing the ideas and the actual work from the people who are actually doing the real work, because it's coming from guys like me on the outside rather than organically from the bottom up. Now, I don't want this to seem like a lecture. That's his job. But it is important to just say AI today is where Excel was yesterday. And Excel, by the way, just two weeks ago, Claude Code is now in Excel. You can actually ask Claude to build out your entire model. So you got a complete programming language, a complete AI, a way to deliver it. You got a user interface. It's a complete database built in. Now, what are our excuses? We just didn't know, right? That's what we have to go work on. Lisa, you had some comments.
Some of your key points, and thank you for an excellent panel conversation. I think you're touching on some really important points, right? Put a few engineers out in the footsteps. I usually don't need a mic. Putting a few engineers out in the footsteps of our nurses, our doctors, our patients. That forward deployed engineer is a model that I highly recommend and endorse, right? There are some vendor solution partners doing that incredibly well. Others doing it, I would say not so well, but doing it. It's a model we're also working to deploy. The pod, absolutely a model that also helps accelerate. One, you got to get the right problem or the right definition of the problem, first step, and then getting people energized around, I see the problem through a different lens than you do, than she does, based on the role that we play in the organization. It helps with the change management because at least all of the voices are at the table. I think I'm a little bit less energized around the idea of put AI out there in exactly the same way that we do Excel. There still are the security, privacy, interoperability, the need for assurance that and you said it, but we don't want 100 people across the enterprise spinning up 100 rogue agents or bringing in, vendor solutions all over the place, right? So that idea, again, of a platform that lets us, deputize builders of their workflows,
Yeah.
I think
Oh,
makes a ton of
that's
sense.
a great word, deputizing. Yeah,
Yeah.
that's a fantastic word.
So it's the hard work, but I think the really exciting place that we've brought this to.
In some places in
Yeah.
academic medicine, from a researcher methodology, you may need to use technology, right? Your vendor tools to create a sandbox for them to do that in a segmented model, right? So there's opportunity to make some areas thrive, but there are areas where you don't want to, really cross that line. So completely agree.
Yeah.
But just to add what Clarice said, in IT, I mean, there's so many invisible layer, right? And if we worry about shadow IT, we worry about people are doing things, and we worry about security, but that's not user problem. We want a user to build that great thing, but it's our job as an IT, make sure that every layer is secure, every layer in IT is reliable, every platform that we have is reliable and highly scalable. And this should be given in this day. And that is the only way we can actually humanize the technology. Otherwise, we're going to have a constant fear of security, cyber threat. You know what? We are in a war, whether we believe it or not. In the cyber world, we are in a war every single day. Devil never sleep. But does that mean we are not going to use the computer? We can just shut it down and nobody's going to attack us?
No, the safest computer is the computer
Yes.
that's turned off.
So look, and in terms of the AI, sadly, over 80% of the AI initiative are failing in the first 6 months. And it's not user, it's not the people who wants to try AI. I think in IT, we failing them because we have not built the infrastructure. We have not built a different layer of in the IT is successful all of the AI model. And reality is AI is here to stay. It's up to us to do it right. And if we don't do it right, we are going to make healthcare equity larger than what it is today.
Yeah, the inequity for sure. Question here, and then I guess we had two questions on that same table. So it's a very inquisitive table. Go ahead. I like it.
Yeah, so I do like the idea that you guys are getting like the medical student or other health professions like ready, like integrating the technology before they roll out and everything. But I guess my question is, what about like the old folks, like the old providers, like they're so stuck in their ways. So how you guys really like how you guys get
It's called retirement. You don't worry about it.
because you don't have to like unlearn what they've already known because you're just stuck in like ways of doing things. Like you don't have to relearn because it's quite a lot. So you guys are focusing on the younger folks, but what about the people that already have like experience from how they actually learned and everything? Like what are the measures or like how are you guys gonna?
It's a great question. Jeet,
I feel the pain. I just learned last week LLM. So again, it's a continuous learning process. For me, is the velocity of information which is coming. So you have to really pick the exact signal from the noise. There is so much to learn. I mean, half side of my body wants to learn what are the new clinical processes or guidelines or care processes. I mean, the half side of me wants to be a little bit more technical. So that's not my comfort zone. My comfort zone is to talk to people, touch somebody's hands, and I'm very grounded. So for me, the technology should be in such a way that we spend less time on the screens and more time with talking to each other, understanding, because that AI is not going to solve. I mean, yes, ambient technology is very helpful. At least I don't have to document so much, somebody is documenting on behalf of me, but still I have to understand what are they actually documenting. Again, I think it's a continuous learning process. We are at the crossroads between the digital and the paper, at least for me. and it's very painful. I'm sure those who are younger generation, those who continue to provide clinical care, it may be a little bit easier because as we learn more about these agents or technology, the users will be a little bit more smarter.
Yeah, and we are at time, but I thought there was Mohan. Do you want to take a? You want to take a? Or
Yeah,
let's
I
give it to
just
the young
wanna-
lady, and then we can let
I
you.
want to, oh,
Yeah, there was a question right there.
can I go? There's a question.
Yes.
I wanted to follow up on what she was
Oh, let's.
asking.
Yeah, you can answer.
And I
both.
wanted to say, I think it's a proud moment to have like SUNY grad, downstate student here today.
yeah.
You know how we're talking about, having less systems and, sustaining the one that we already have. So in terms of like, the educational system, like what is actually one way that we can make students, starting from like university and all, work in teams? Like, how can we have that mindset shift from like working in teams than silos? Like, so sometimes you have like all this group project at school and all that, and you're always encouraged to like, oh, you can work on this team projects, and some students are like, I don't really, it's not really my thing. I just feel like what is one way that we can start, right from the educational system before we get to like more like system levels and all. Like, how can we have like university students, college students start working in teams on like apps, projects, and things
Yeah. So
like
Dilip,
that?
you can answer the young lady's
So
question before.
how about this? Can we get a round of applause for the SUNY? The largest education institution in the country, and I'm proud of SUNY. Look, there is no substitute from the institutional knowledge. Those who've been in the industry, we need those. We cannot say, you know what, we are just going to be relying on the next generation and they are going to build the next best technology and we are going to retire all of this old. No, that's not what we need. We need to make the technology as easy so that an 80 years old grandma and a 16 years old, the tender age boy or girl, they use the technology same way. Ambient listening. I think that needs to be foolproof. Many organizations have implemented ambient listening. They have to roll back. That's the failure on our tech leader because we have not done a good job. So technology has to be seamless. I recall, my mom who never went to school, who has no idea. She cannot read or write, but you know what? She can use the iPhone. And that struck me that people can do almost anything.
That's real tech.
That's real tech. Okay. And my mom is a real user. We have to make healthcare technology so that someone like my mom can use this. We don't have to worry about the old people on the way. No, they are not on the way because we just made their life difficult introducing all of this technology in healthcare.
That is a great point. Mohan, did you have something you?
Oh, I don't want to talk anymore because there's lunch waiting.
Yeah, that's all. So good advice from Mohan. So
Shahid,
yeah,
if I can
yeah.
give the closing comment. The education system across the globe, I frequently travels outside US, and it's not about the college or universities. I mean, if you look at elementary schools, middle schools, and high schools, there has been incorporation of these technology into the curriculum. So I'm very, very optimistic that those kind of things can be translated in US as well. I don't want to give examples of certain countries, but this is already into the elementary school and middle school and high school. So hopefully in next generation or 10 or 20 years, we will not be talking about the challenges which I am facing since last week. Hopefully they'll be learning much better early on.
that's great way to close this. So let's give a big round of applause